They've become a household name over the last year. The team at the Siouxland District Health Department had to quickly adjust to ever-changing protocols from health officials and questions from the public. Our Vivian Rennie sat down with Director Kevin Grieme and Deputy Director Tyler Brock for an in-depth discussion on a year they won't soon forget.
How early did you guys start preparing when the first cases were being discovered versus when they actually were implemented here?
I think probably we started when it started to spread more throughout the world, and clearly when it became evident that we were going to get some of that here in America, that it was going to be a person-to-person spread. That was definitely when we started kind of getting our radar up, and it's like, oh, we better figure out what this is, what we've got, and how we've got to talk about it to people. That's really when it started.
Did you guys have any projections on what the cases in Woodbury County or this area could look like? And did we kind of hit those? Like, how did those projections look?
I'll speak for myself. No. Every time we tried to make a projection, we ended up being wrong. You know, I mean, it went from being very plentiful, you know, very high caseloads in the eastern part of the state at the beginning, and here in western Iowa we had virtually nothing. And you know, we were kind of sitting there, you know, we think we're probably going to get some cases, but we had no idea how many.
We had that first case we announced on March 20th of 2020, and I just remember at one point in time a conversation Tyler and I had in the, you know, it was like a week or so after that, and we had not had another positive. And so, you know, we're seeing this unfold in the other parts of the state. And we're kind of you're just sitting here waiting that proverbial shoe to drop. And for a while, you know, it's been like a week to 10 days, and we're like, is there something going on are we going to escape any of this? But all of a sudden then, that first part of April, just a few trickle of cases, and then by about the third week, it just went, you know, through the roof and continued through May.
What were some of the biggest successes that you guys look back over the last year?
Wow, I think it was our partnership response, I would have to say, is one huge success, and that's now carried forward into the vaccine rollout.
As you look back on the last year, is there anything else that you think is important to make sure that the community knows?
When I first started doing this, I thought, you know, the kind of cooperation we had, I just thought that was very common everywhere. But we've come to realize that it's not. And so one of the things I'd like to make sure that the community understands, and I think they do, but just the level of dedication that, you know, the medical community and public safety and everybody, honestly, from businesses to that kind of thing, have really done a lot of work to try to minimize this pandemic. It's been a really difficult situation, and to try to deal with that as best they could has taken a lot of effort from a lot of people.
But also we've had to rely upon community volunteers. So once again, the individuals have been willing and able, and they've done a phenomenal job stepping up to put them in volunteer roles that just help provide guidance to the people. The comments we got that says everybody was friendly. If I had any questions, they could get us answers. That's really a tribute to the volunteers and those that are staffing to do it. And that's what we like to say Siouxland is about.
To see Vivian's full 30-minute sit-down interview